Notorious productive family, the Mississippi dynasty, the prince of King Bae.
Yeah, so basically we're saying that in order for someone to go for like this surgery, they need to prepare at least $15,000 just to make sure everything is safe.
You will have some leftover, but that will be the most suitable budget that you should have.
Right. Okay.
Like if you want to have your comfort for, let's say, more than 5 days, to make sure that some people are scared to fly, especially those of us flying long distances, because I think it was 12 hours or 10. I'm not really sure.
So it's a long flight.
Yeah, it's a long flight.
Okay.
And to be safe, because you don't have blood clots, while you're flying, you have to inject yourself every 4 hours?
Oh,
you have
really?
to, yes, you have to, because you're inflamed. You just came out of surgery.
Wow.
So there's some people want to be safe and pay their money and stay for maybe 5 days,
just
to
so
be
their
sure.
body is good.
Yeah, some people want to, economize.
I think it's better to do that. There's no point taking that risk of flying that much.
The thing is, the doctor himself is expensive. You will go for some other people, you will pay maybe 6,000, 5,000 and get it done. But his service is already expensive. So some people will be like, okay, I want this surgeon, but I want to stay just 2 days. So yeah.
I mean, if you have to go to the best and then you want to economize, but as well, you don't naturally need to be in their facility, right?
Yeah.
I'm sure in Turkey there are lots of hotels and places where you can book to stay.
That's,
if you are trying to economize, but it's better not to travel if that is a condition in which you're gonna have to be there, right?
Yeah.
Because you're just from surgery. There's no guarantee. Like once you're up in the plane in a 5 hours flight, there's an emergency. Maybe it's 5 hours to your destination or 5 hours back to somewhere. So there's no medical staff on the plane. They just want an operation. There's no point.
And the nurses are really the best, because when every 4 hours, or for example, if they have to do something, they come and they look at you. Are you okay? They check, is your bed? If you need, you just press and they are running to your room like it's VIP.
Of course, you pay lots of money.
Yeah,
so
you get what you pay for.
Exactly. Okay. So the next thing that I want to talk about was like so like the recovery and the immediate effects of everything, right? So like let's say you were done, you stayed there. You say you stayed there for 4 nights and then you travel back to Canada.
4 to almost 5.
Yeah, and then you travel back to Canada.
Yeah.
So and during your flight come back to Canada, you say you're injecting yourself every 4 hours.
Yes.
So that's basically probably like what, 2 injections during your flight?
I cannot really remember, but I think so. Yeah, because you had to inject, and the nurses they'll message you. They keep messaging you to reply.
They keep in contact with you just to make sure everything is good.
Yes. Please remember to inject yourself. Even before the surgery, that evening when you're landing, you have to. They send the driver to pick you at the airport, and they tell you to inject yourself before getting there. You inject yourself, then they bring you to the hospital.
Right. So, but during that part where you had the surgery and that immediate finishing and you're just there kind of recovering, what do you think was the hardest part for you?
I would say when I was getting to the ward, I was confident about the doctor and I wanted to see him first, and he was like, oh yeah, I'm here, Sandrine. So I was scared. It was that hard part, but the comfort they gave me, like they pushed me. Then there's an elevator, you go there and then they take you down. It's so nice.
The process is like seamless.
Yes, they make it really like you shouldn't even feel it. I didn't even know when I passed out.
Right.
But yeah, but the hardest part I would like is the recovery process. When I just got out, now I realize that okay, what did I just do?
Right.
Did I do the right thing? Was it just me wanting to get that fat off my body?
Right.
But I was like, you know what? Muye se muye. Amen.
Yeah.
So the first time when I woke up and then they told me to drink water, and then I could see blood, and then I wasn't able to drink water. I had to put water in my mouth and spread it like when you fry pancakes, and then try to push it down to your glands bit by bit, and I could feel so I was like, what did I just do? I wasn't able to eat, and you're not even allowed to, and you could see the scale dropping really quick, and then the fact that at that night I can't forget when I woke up I was shivering, like I was shivering, and then the nurse was like, no, calm down, you're fine. I was really shivering, yeah. So the recovery process wasn't easy, and the fact that you are shivering and then after you just shivers, the nurse have to force you to move. It's like
Right.
You know, they are trying to push you to make
Sure.
it easy, but it wasn't easy recovering.
Wow. So the short-term recovery just from coming out of the surgery, it's kind of tough.
Yeah, it's tough. Like they had to move. You have to move to get the gas off your belly.
Right.
So they'll tell you move. They take you from one aisle to the next. Like it's like you're about to labor.
Oh yeah.
And they're pushing you. Come on, you can do it. You can do it. Then you want to sleep. Like you would just want to sleep. You're trying
because the medicines that they give, the medications that they give to you, are probably still in your body. So yeah, that's crazy. Wow, that's crazy. Ooh.
Yeah.
All right. So basically, drinking water was kind of difficult at first. You did not have to eat. How long did you not have to eat?
I think it's phase by phase. The first week,
when you initially came out of the surgery, you mentioned that you did not have to eat, but for how long did they tell you not to eat first? Like when was your first?
I think 1 week.
After that.
Yes, but the thing is, it's not like they said you don't have to eat. Your food now, because you're a baby,
right?
Your food is water and broth.
Oh, okay, I see.
So
you're not gonna eat regular food.
Yes.
But then you gotta take those liquid food. Okay.
Yes, so that's the food.
Oh, that makes sense now. Okay, all right.
Because your stomach just got stitched.
Sure.
So if you try even spicy or whatever, you're gonna die. Because to be honest, I went and my mom made some spicy food. Is it my mom? No, she didn't do that. She made the normal broth when she realized it. Then, I ordered shawarma. I think. Jesus, I almost died.
Oh, wow.
Yeah.
I know. Sometimes you go through those things but you see how the cravings of all the things. Wow, that's crazy. Okay. So I understand the short-term effects now. Like people need to be watched for that. Yeah. What about the long-term, like the kind of long-term effects? So how long has it been now since you completed that process?
5 months, I guess.
5 months. And in 5 months, you said you dropped 54 pounds.
54 pounds.
And that's 54 pounds and going down still.
Yes, and to be honest, I'm not even respecting it. Because if I was respecting it, I wouldn't be sitting here I'm not even respecting. But the bad thing of not respecting is because you can have loose skin, all of that. So I'm still working on it. You have to go to the gym to tighten your skin.
Right.
So I'm not be respecting it because I'm trying not to over lose it.
Okay, so you're kind of trying to stabilize your weight so you feel like you like it where you are right now.
Yeah, I like it. I still feel I'm chubby, so I want to go down a little bit. But I don't want to overdo it because I still have time. Like they said, you lose for a year.
There's no.
I am just 5 months.
There's no way on earth you can please a woman. Like you still feel chubby right now.
Well, I feel much better in my body.
Okay, I understand that
unlike
you feel
before.
much better, but I don't see why you're not chubby at all.
Okay.
You're already getting to that skinny part, but not like skinny. You know? Okay. That's crazy. Wow. Just wow. Okay. All right. So, did they give you right now? Are you are you on a diet, or were you on a diet after you came, or just no? You just eat anything but smaller quantities.
Well, to be honest, I would advise anybody to follow whatever they say because.
But what did they say to you?
They told me to. I had a diet I had to follow. Like the first week, water, broth, and then I jumped to protein shake. They gave us protein shake in the hospital. It's included in the drugs that they give you. That they give you a box of is it Biristat? I don't know whatever the name is. One protein shake you have to mix and drink. It's like a baby milk. So that's with the food too. Protein keeps you full, and it has some, maybe what your body needs at the time. So it's phase after phase. They told me that beginning, water and broth, then protein shake. Then the next I could eat. After 2 weeks. I still have some of the things,
Right.
I think after 2 weeks, then you can start eating puree. Then 2 more weeks you start eating, but they'll tell you not to eat.
I don't think I could do that. changing to eat stuff like that. But I mean, think about it. If anybody is in that situation that you're in, you'd have to make some adjustment, right?
Trust me, with the investment and so far you've gone into it,
right,
you'll be forced to do it.
No, you definitely will be forced to do it, even if you don't want to.
Yeah.
Oh, okay. So are you also working out with your diet as well?
Well, As of now, to be honest, I'm not even been following it. I work out. I do when I feel like, or when I feel heavy. Let's say sometimes, because the movements is your bowel movements. You know, when they tell you to work out, you make steps.
Sure.
That's what they tell you to do.
Yeah.
So it is because you're no longer like a normal person.
Sure.
So it is the.
So you're not normal so you're not a normal person now.
Well, I'm a normal person, but what I mean, like, you know, the normal, your immune system, you know, like a normal person's immune system is not the same.
Sure.
So the fact that I move, it kind of pushes the digestion and everything. Yeah.
Oh wow, that's crazy.
So when there are days that when I'm not worked out for long and I feel unease, and you know, you have to detox, you have to, you know.
Sure.
So I go make my movements, you know.
Oh wow.
And it helps me feel lighter, feel in my space.
Right. Wow. Okay. That's so nice. So the other thing I also wanted to ask, even before, I think before and also as of now, it's like, did you think that the whole process from when you were just getting that so much weight and now that you have lost so much weight, how did it affect your mental, like, you know, your own mental health and stuff like that?
Well, I wouldn't lie to you. In the beginning, I didn't respect it, so I had a lot of stuff. I didn't respect it because I didn't come to Canada directly. I stopped Europe, Africa. So I ate what I was not supposed to eat, you know.
Right.
And then I had a lot of juice because I could not eat, of which that was not supposed to be the case.
Right.
I had stalls, and then I was losing my mind. I was like, oh. So I got to all of this and I've lost just 10 kg.
Right.
I wanted it really quick.
Right.
So
you wanted to see the changes right now.
yes. And when I spoke with the nurse, they were like, you are losing it, but you will not see it on the, you know, you will not see it.
Yes.
So when I got back to Canada, I wore my trousers and I could feel space. And I'm like, oh, so truly I'm losing it.
Yeah, you start
like,
losing weight bit by bit.
Yeah, I feel it. And then I see the scales start going down. So they said stores are normal. Everybody will feel stores. Some other person will lose maybe 100 kg in 5 months.
Sure.
Then another person will lose. It depends on your height, and the proportions are different. So don't expect A's journey to be B's journey.
Right. So okay. Then how do you, like, right now? How do you feel? Like, how do you feel in your own self? Like, you know.
I feel confident.
You feel confident.
I feel confident. I feel much more better.
Right.
Because
you know why? The reason why I'm asking that question.
Why?
Is because I realized months and months before you went for the surgery, as you said, I never saw you, like, you were very unactive on social media.
I know.
But then I felt like after you came back, I think we had conversation, and after a while, I could tell you start being active. I could see you just punching out some few stuff. I was like, oh, this person now, they're back. They feel like they're back in the game. So, no, but I'm really happy that you feel that way and you had to go through that process and it's working out for you.
Yes, well, I'm not actually a social media bird, like, to put it out there like that. But the confidence sometimes pushes you to do it. When you get compliments and you're like, okay, I should.
Yes.
But yeah, it's way better. Like, I feel more confident. I feel myself. That satisfaction to wear whatever you want to wear and still feel good in it.
Okay. All right, that's good. Okay, so the other thing I want to talk about would be like some kind of challenges and like setbacks and stuff like that. So, like, after going through this process, like, you know, up to this moment now, what do you think are some of the challenges or the setbacks that you're feeling? Like, I could say, let's say something would be like, for example, maybe you're not able to eat as much as you want, or eat anything as you want the time that you want. Like, what are some of the challenges and like setbacks that you faced?
Okay, so I'll be very transparent. You won't be able to.
It's important that you transparent. No, for you, not for everybody, for you.
Okay, so you won't be able to drink water anymore, like gurgling like this. You always have to sip. I'm already used to. Right. It's 5 months already. I'm adapted.
So is that something that you always do? Now you cannot.
You know that satisfaction that when you, like this, if you open your drink, go, and then you can't do that anymore.
You can't do that.
You can't.
Right.
And then food, I now eat like a baby. Sure. Like just little portions, and then you literally really have to feel the food going down. Sometimes it's tugged and I'm just like this.
Right.
So I miss that, like that.
That's my phone.
I miss that fact that you can eat. You know, when you see food and you eat, and then you get that satisfaction after eating.
Right.
Now I don't feel that much. But I'm happy with that restriction because it restricts me without. You know, sometimes when you're dieting, you'll be like, oh, you started 1 week, and then the next week you see when you make a food which is really good,
right.
and you know, and then we African ladies, we cook, and then you eat, oh, it's good, and then you eat.
So now it's like, nah, you can't do it.
Sometimes you're forced to. I've learned that you must not finish everything on your plate. Sometimes even when you cook, you eat, and then you look for people to eat. If not, you have to dump the food.
Right.
Yeah.
Right. That's crazy. Okay. Wow. Apart from that, is there any other like setbacks again that you feel?
Acid reflux, but I didn't have that much because I tried to do it natural. I didn't just rely on the drugs. I blend a lot of legumes, vegetables, greens. You know,
right.
Try to get the vitamins the natural way.
Exactly.
So it helped me a lot.
Right.
Yeah, when you lose weight fast, especially you develop back pain. I had that hair loss.
Also, these are some of the things.
Yes, I cut my hair.
So these are some of the complications that you have.
Yes.
But those are only temporary, right? They're not permanent.
Well, it should, as per what they say. But if you don't follow maybe your drugs, if you don't feed well, if you don't try to force yourself to eat, you know.
So the condition.
Because you have deficiencies
yes,
at that time.
I understand. So even right now you have deficiencies, right? Because you don't eat your proper meal in the proper quantities. Definitely you'll be having lack in some vitamins, and this will all cause some kind of problems. But it is showing that as of now, the state in which your stomach is, which is tiny or whatever it is, that's how it's going to be for the rest of your life.
Yes.
And
it can stretch, but it will still be the same.
Right, and which means the way you're consuming food now, is that going to be permanent?
Yes, they said the portions can increase, but it will never be like, you know.
It will never be like, you know, just go like for a food competition.
Yes, and even if it's as a food competition, if you get to that, because it depends on each individual. So if you're disciplined and you choose to engage in this journey, you should try not to stretch your belly. And even if you stretch it and you have that large portion of food, you eat, let's say, 1 p.m., keep it at the side. You can eat 1-2 spoons, keep at the side, come back 3 when the food has gone down, come back again at 4 p.m. eat. So it's bit by bit, and maybe you can eat half of that plate.
Let me ask you one question.
Okay.
So, based on what you've told me, and I've understood the whole process from, you know, going through the operation and blah blah blah. What the operation does is practically just reduces your ability to eat food the way you want.
Exactly.
So, if any human being who has a weight problem is able to like discipline themselves properly and only eat a certain quantity, probably the minimum quantity of food, the lowest quantity of carbs, they would lose that weight.
Yes, exactly, and that's why
so the myth of why the myth of why people say they are fat is a lie.
It's a lie.
You're just eating too much.
Yes, and also you're eating the wrong thing, because in the beginning when the operation, because they say you will lose weight for a year or maybe a year and a half, really quick. But now with time it reduces the way you lose the weight. Let's say earlier I used to use 4, because at the time my stomach could not contain carbs. Because if I eat anything heavy, it's like you drop a stone in my sack and I'm so on ease, like, you know, even sitting down, so I'm like, you know, I'm very on ease. That's why my stomach is stitched, double stitched, you know. So I don't want to overweigh my belly. I drink liquid, you know, you understand. It's like a balloon when you put. So at that period of time when my stomach is sensitive and I'm not eating carbs, I'm losing fast. So now that my stomach can even contain carbs, I will not lose that much. So that when they say eat protein to stay full and eat the right thing. And moreover, if you're eating the right portions, you will lose the weight.
Okay. So guys, you guys heard it.
Yeah, and protein is not for you to lose mass.
If you're getting too much weight, it's because you're probably eating too much.
Or
if you're
wrong.
not eating too much, you gotta, cut the junk foods.
Yes.
And eat the right stuff.
Yes.
Eat lots of vegetable, less carbs, less fatty food.
Yes, and then they said eat protein so you don't lose, because now you're losing weight, it can really go fat. And if you don't eat protein and you don't take your vitamins, you will look malnourished.
That's why they give you those supplements.
Yes, and then they tell you to eat that protein so you don't lose mass. You should lose just fat, but not mass.
Exactly. Okay, that's great. That's good to know. Now, another question I want to ask is very serious.
Okay.
I know that you've lost the weight and you're feeling good.
Okay.
Do you think that if they were to rewind time, will you do this all over again, or are you gonna be like, maybe I would have? You would have done it.
I will.
So right now, if you meet somebody who's struggling with weight, you tell the person go do it.
Go do it.
All right. Okay. So, okay. Basically, you've done it and you're said it.
Yeah, I'm sorry to interrupt you, because actually we are not really oriented right food, because we'll be like, it's about our health.
Sure.
Your gut is involved, PCOS, many other things that comes in when you're overweight. Like even up to now, I'm overweight, and the advice I'll pass out: take your height, take your weight, and then evaluate yourself, your BMI. Are you overweight? Are you obese?
Sure.
Are you you should fall in the right category.
Right.
So when you fall in the right category, then you know what was the right word? You're in the right track.
Right.
So that starts. That's how it starts. So when your BMI is right, then you're living good. Some people, they start snoring. It's not good.
Right.
It means you're sick.
Yeah.
I don't know if I'll use the word sick, but all those...
You're not as healthy.
You're not healthy. All those things comes, illness. People even die out of... I have a friend that died out of overweight.
Sure.
She just slept and never wake up.
Right.
So,
because overweight means you have a problem.
You have a problem. It comes cardiac arrest, all those things that... are not good. If you are living, you should take care of yourself. Exactly. And it starts not just from outer looks, it starts from within.
Yeah. You gotta be clean from inside.
Yes.
For the outside.
Exactly.
That's crazy. So what would be your advice for anybody who's suffering from weight and wants to undergo this process? By the way, the other question I wanted to ask is, are there other processes similar to this?
Yes. I also asked to add that this weight comes with age. You see someone very little, and the person, if he or she tells you her age, and then you're like, oh my God. You see, they are mostly, you hardly see a fat person which look, when someone is like tiny little skin, those most tiny people with little skin that are really their BMIs are really good.
Yeah.
You see their weights, their faces, they don't look that older than their age.
So what do you say? Like if you're younger,
like weight comes with age.
So the more age you get,
the
older you get,
the more overweight you are or obese you are, you might likely look older than what your age.
Oh, okay. So you're saying that the fat in your body affects the way that you look.
You look.
And like in terms of like your age, of course, definitely. Most of the times, if you see like some of these American kids, like you see a kid for like 12 years and they look like somebody who's 25.
Exactly.
It's like they're all grown, right?
Yes, that's why you see our grandmothers like great grandmothers, they eat healthy vegetables and they're still strong and
Those people did a lot of
exactly.
work out and stuff like that.
And if we go back to the other types of surgeries, we have a gastric balloon where you put they insert the balloon in your belly and it occupies your belly and makes you full.
And it stays there?
Yeah, it stays there for about, I don't know, it makes you full like for a long time. You are unable to eat, you feel unease, for a long period of time, and then the balloon just, I don't know if it dies, it kind of explodes and passes out. For those, I wasn't really interested in the gastric balloon, so I didn't research much.
I know, there's a lady I know, I think she did something like that. I'm not sure if she did what you did, or that balloon thing, but yeah, she couldn't eat as much.
Yeah, but I wouldn't recommend that to many people because the gastric balloon, once it goes back, you can see it again.
Right.
But the gastric,
you have to go back again to get it done.
Yeah, You lose the weight, and what if you take it back?
Right.
So the gastric sleeve, 80% of your stomach is out, which I fall in that category.
Right.
Then you have the gastric bypass. That's the ground thread, the bigger one of the gastric sleeve. They cut your I think they cut your, is it the like your intestine, and then it goes to, they cut your stomachs in some way, you know how food passes and goes to your stomach somehow, then it now goes to your intestine.
Yeah.
So they just make, they make it, I don't know, the way food passes in a way that...
There's like a grade that's below the grade that you are, and then there's another grade on top.
Exactly.
That's crazy.
And now they've introduced
do
another one that...
stuff?
Yes, men, they do. I had one of my gastric, birthday partners was a man.
Oh, wow.
He was from the UK. He came with his mom.
Whoa.
Yeah.
Whoa.
People traveling everywhere to come see, what's his name? Dr. Tufan.
Dr. Tufan.
Ejeng.
Oh, shout out to the guy.
Yeah.
He's the man. He's saving the fucking day.
Yeah.
All right. Okay. That's crazy.
So they've introduced another one. They shrink your belly. That's I don't know how it's called, but I think before I made that decision, or immediately I made that decision, they introduced that too. So they shrink your belly. It's like stitch your belly.
They stitch.
They don't take it out.
They don't take it out. I'd rather that one. The day that you want it, they can go on stitch and it comes back.
Probably, I'm not sure.
All right, okay, that's crazy, but that is so informative, you know. But wow, that is really a shit show for people. Anyway, Sandrine, that was so much information. I hope that I'm gonna get the links, for the hospital.
Okay.
And the doctor or the contact, so I can put it in the description. And those of you guys who feel like you gotta go down weight, I'm gonna grab some pictures from Sandrine and I'm gonna post
and
it
I have
so you guys can see her before and after.
No way!
What?
No way!
What's the point?
No way!
They already see you here. What's the point?
I've not yet gotten to that point. And moreover, you have to, this thing is not easy, because when you start it, you might have to move to the next thing, because there are many things that you might have to work out.
I guess that's the process.
The loose skin, all that stuff you have to work on. So
this is the process I find. This is the worst thing I find with this surgery stuff. Is once you start, there's no end, right?
Yeah,
because then
it's always quick, the easy way.
The next thing you're
it's
looking,
not easy, yeah.
The next thing you're looking for is the next thing to do, the next surgery to do. Look, that's why people are doing butt job, nose job, this job.
No, but that's more cosmetics. This is more health related.
It's because it starts from somewhere, right?
Yeah, that's true.
And then it goes somewhere. But that was nice. That was very nice. All right, Sandrine, thank you so much for this.
You're welcome.
Let's talk about it again some other time. Maybe 1 year from now.
Okay.
We're gonna see where you are.
All right.
You're gonna be another.
I hope I'm not too skinny by then.
We'll see. We'll see. I don't know what your goals are, but we'll see.
Yeah, but I thank God that I'm healthy now. I'm really healthy, and I appreciate God for the journey so far. I would say gastric sleeve is just a tool. You have to put in the work, and when you get to your goal weight, then you can start relenting. It's really important, because especially for women, a baby comes with weight. It comes with boobs, it comes with many other things. So if you especially when you're overweight, sometimes getting pregnant is even difficult. You can attract many other diseases. As a woman, we are so vulnerable to certain things, so it's very important to take care of yourself and be healthy.
All right, perfect. All right, thank you so much, Sandrine.